Welcome to the Department of Veteran Affairs. I'm Shawn DeGroot, Compliance Officer for the Midwest Healthcare Network and the Sioux Falls VA. It is my role and responsibility to oversee business practices and make sure we follow applicable healthcare laws, rules, and regulations. Because we live in a world of rules and regulations, many of us carry a driver's license and follow the rules to be compliant with the law. We watch for the green light to go forward, hesitate on yellow lights, and stop when we see a red light. If we don't stop, there are consequences. If we ignore the red light and enter an intersection, we could receive a fine. Our name could appear in a newspaper, but more importantly, someone could get hurt. In healthcare, instead of a stoplight, we use our conscience and follow regulations for the right thing to do. If you work in healthcare, you have a duty to protect the patient, their privacy, and protect the resources at the VA. It doesn't matter whether you clean floors or empty garbage, work in a lab, write orders, fill prescriptions, or perform administrative work. We all perform very important aspects of care for the patients. So what's a green light in healthcare? In the VA, everyone has a green light to provide the best service to our veterans. So when a veteran walks into the door of our facility, we are ready to treat them with respect, document their information accurately, provide a service that is medically necessary by a licensed healthcare provider, provide high quality of care as documented in the medical record, bill appropriately for the service we deliver, and receive payment for the service we delivered, no more, no less. We must all be aware of the yellow light in healthcare, and when in doubt, ask your supervisor or your compliance officer. A yellow light in healthcare might include a missing outpatient order, lack of documentation for a service, hiring an employee or provider that can no longer work in healthcare that is referred to as an excluded individual, and sending bills to an insurance company for a service we didn't provide. These are also examples of simple errors, and if corrected and monitored, the yellow light returns to green. If, however, the problems identified are ignored and repeated, and we knowingly violate a regulation, a red light appears. The consequences could mean loss of public trust, loss of financial resources, and potential harm to a patient. As with any business, even in healthcare, there are consequences for non-compliance to rules and regulations. So what can you do to help? Follow a simple rule. If a practice doesn't feel right, it probably isn't. Pay attention to that yellow light. If you don't know, ask. If you have any concerns or questions, talk to your supervisor or compliance officer. The CBI program, which is Compliance and Business Integrity, offers a helpline for your convenience at 1-866-842-4357. If we follow our conscience and follow the regulations, we will be doing the right thing for the veterans and for our organization. Remember, we are all here to serve the veterans who have already served for us.